Hey, welcome to the Go-To Physio series on ankles. Now, what I want to do is I want to talk about a very important yet often overlooked exercise today that is critical to do, in my opinion, before we get our patient running or even the higher level hopping progressions. Now, with that said, even when you do this exercise, you need to look at the previous lessons to make sure that we're not seeing the motor adaptations that we talked about in the assessment and the ability of the peroneus longus in particular to load during this exercise. So without further ado, let's get straight into it and I'll see you on the other side. Okay, so a big thing with return to play is the progressions that we do in order to make sure that the athlete is happy and safe to go back running. So one of the first things we're going to do, obviously, is we're going to restore ankle range of motion. Then we're looking for a good calf raise. And then once we have that good calf raise, what we want to do then is start to train the athlete's ability to have good intent through that foot and really promote good stiffness, because that stiffness is going to be very important at kind of top end speed, but also acceleration. Because when we're accelerating and that foot has to push into the floor, there's a lot of stiffness required through that foot, and also helping to generate tension up through the limbs. So one of the exercises that I like to use is ankling. Now, if you've kind of seen ankling before, and even when I was in my masters, my strength and conditioning masters, they were teaching this kind of concept of a hip hitch. So ankling is basically, if you haven't come across it before, it's when you basically push that foot into the floor, and then what they were coaching is this hip hitch. Okay, so as you push, you hit your hip. So it's kind of almost like that, okay, where you're doing that continuously, and then you can start to go into a little bit of a walk. Okay, so what we want to do is we want to encourage active plantar flexion through that ankle to promote stiffness through that foot, and then we're also getting this hip to rise. Now, rather than coaching the hip hitch like I was taught in university, I think sometimes there can be a problem with that, where the athlete will focus too much on the hip hitching and not enough intent through that midfoot. Okay, so what we want to do at the Post-Sport Academy is we want to take a step back and we want to look for the hip hitch to occur naturally. Okay, so I don't want you to coach that hip hitch. What I want you to do is I want you to look naturally for that hip hitch, okay? Because what should happen, the more intent I've got through this foot, naturally that hip is going to start to hitch anyways, okay? So rather than going, okay, I want you to push and hitch, what I want you to do is I want you to focus all your coaching on getting that athlete to push with good intent through that midfoot, okay? So the more intent he has through that midfoot, the more stiffness, that's going to generate tension all through the limb, especially this lateral side, and then that glute medius is going to do a lot of the work in helping hitch that hip anyways, okay? Whereas sometimes the athletes can cheat. If we focus on the hip hitch, is they'll use their QL concentrically to do that movement with a lot less ankle movement. And if you get up and you do this yourself, you can actually see I don't have to have a lot of intent through the toes here. I can just focus on hitching the hip. Whereas what we want to do as therapists, and we want to make sure that that athlete has thoughtless, fearless movement through the foot, is we focus all our movement and all our intent through that ankle or through that foot. Okay, so for Pete, what I would say to Pete is, Pete, we're just going to encourage you to get some stiffness and aggression back, to show your nervous system that it's safe to push off the ball of the big toe, the ball of the little toe, and all the other parts of the foot, okay? Because sometimes when you've had an injury and you've had a bit of pain, your nervous system, brain can maybe want to protect these parts. We just want to show it that it's safe, so that when you get back onto the field, you're going to do it with thoughtless, fearless movement, okay? So all we're going to do is we're going to start hands on hips to start, Pete. And all I want you to do, Pete, is as your foot comes to the floor, I almost want you to attack the floor, okay? I want you to beat the floor. I don't want the floor to beat you, okay? So what you're going to do, let's just start with a tap, okay? Just a few taps like that. And I want your foot to feel real stiff, okay? I want you to imagine that your foot is a block, basically, okay? So your foot is hitting the floor as one. It's not soft, perfect. That's it. And now that little bit of an echo there, okay, from the floor is good, okay? Because if he's kind of just going with the toes, it's a very different sound. So he'll get a nice hollow sound, okay? Now what I want to do, Pete, is as you come down, I want you to do the exact same thing, okay? I want you to push into the floor but I want you to push with good intent, okay, so that you lift your whole body weight, so that it supports your body weight, okay? So hands on the hips, I want you to push down, attack the floor, and I want some nice aggression, but I want to keep that ankle stiff as you do it. Good, and back down again, perfect. That's how I would start this with the athlete, okay? So same again, Pete. Good, good, and again. Good. Now this time, Pete, I want you to get as much of the foot into this action as you can, okay? So I don't want to just go up on your toes. I want you to try get as much of this part of the foot involved as well, okay? Because if we just focus on the toes here, we don't run on our toes when we sprint at top end, okay? We're hitting a lot of the foot. The midfoot is going to strike the floor as we sprint. We don't sprint on our toes at top end speed, okay? Acceleration, we're going to be more on our toes. But for top end speed and stiffness, we're not going to be on our toes. So we want to encourage the athlete to get as much of the midfoot as he can, okay? So push, that's better, Pete, good. Push, good. Push, good. And I use my voice to encourage Pete to be a little bit more aggressive, okay? So notice when I say push, I'm getting a little bit aggressive because I want that Pete to also be aggressive with the foot, okay? So let's just watch this again. Push, good. And push. Good, come on, push. Good, there we go. And just how my voice there helped Pete just to give it that little bit, okay? And that's important for you as a therapist to understand that as well, that you can use your voice to help the athlete feel a little bit more confident and get that kind of subconscious self-organizing happening rather than him consciously thinking about it, okay? Because when I said that there, he just self-organized and he'd done it, okay? Which is great. Okay, Pete, that's good. So that would be my first one. Then what we're going to start to do then, Pete, is we're going to do every second leg, okay? So we're going to push, 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 okay? So we're just going to do that for a few reps. I want you stiff and I want you aggressive to the floor, okay? I want you to beat the floor. Good. Keep it stiff. Good. Push, push. Good. Much of the foot as you can. Good. Perfect. And relax. Good. So we're starting to get the basics here now. Pete's, he's starting to get it. He's starting to pick up what we want, okay? Pete, what I'm going to get you to do now is I'm just going 3 steps forward, okay? So I want you to do 3 in a row. 1, 2, 3. And then we're going to go 3 steps forward, okay? So we're going to do that again. All the rugby league lads will be mocking me here saying 3. Good. And back again. Good. Okay, so I want you stiff, 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 and then I want you 3 forward, okay? Good. Okay, so we're starting to get that stiffness and intent back again. Then we would start to go to more advanced drills, okay? But even just helping the athlete get that stiffness and being happy to be on the toes and the midfoot, okay? So it's not the toes, the pads of the toes, it's the balls of the toes with a bit of midfoot. That's going to be important, okay? Because we're going to be contacting that part of the foot when we're sprinting, okay? So we want that stiffness, that encouragement to do that. You're looking from behind, you're seeing, is the athlete happy? Is he able to stabilize in that position? Because that foot, when he's doing it, is about here, okay? So he's not fully up like a calf raise. He's not down, he's about here. As that foot hits the floor, his heel isn't on the floor, it's just slightly off, but the foot is very, very stiff. And that's all we're trying to encourage here. So once we have that stiffness, or we're a little bit happier with that, then we're going to go on to some hopping progressions. Then once we're happy with the hopping progressions, then we're going to be happy that that athlete is ready to run, okay? So where this ankling fits in, full range of movement, a good calf raise, thoughtless vertical movement, then we want to make sure that he's happy with the stiffness. So again, if Pete's doing this and he's getting pain at the back of the Achilles, or he's getting pain in the front of the ankle, maybe we're just not quite ready for this yet, okay? So maybe we've got a little bit more work to do with either a hands-on treatment or whatever, okay? So this is a nice intermediate between the calf raise, between the full range of motion and the hopping, okay? So the ankling is to encourage that stiffness, and the work that we're doing now is going to help that athlete when he gets back on the field and he's working on his accelerations and he's working on his top end speed and that stiffness, okay? So all this now, we're actually working on his return to play and his running progressions, okay? So this is the first step in order to promote that stiffness that he's going to need in running, okay? And that's how we can get that athlete back running when he gets back running, he's not going to have to spend a lot of time doing his running progressions because he's earned the right to get there, and he won't have to kind of learn how to do all this stuff and figure it out when he's there because he's already done it. Okay, so that's your ankling. Very, very powerful. So there you have it, a very, very important exercise, and make sure there's good intent going through that big toe. That peroneus longus is very, very important in order to build tension all the way up into the glute med. If you've got glute med issues, you've got persistent right-sided low back issues or one-sided low back issues, and they've had a previous ankle injury, go back and check that stuff. Go back to the previous videos in this series and make sure you clean up all that stuff. We want to build rehab programs built on rock solid foundations, not rehab programs built on quicksand. As always, if you enjoy this content, you want more, you want to know how to look at the body as a whole without getting overwhelmed, head over to thegotofysio.com. I've got plenty more tips and resources there for you. That's it for this week. I'll see you next week on our next series when we start looking at the lumbar spine. See you then.